So on the night, I was told that I had COVID. Oh, it's a very... I cried actually that night because it's so stressed out. How can I get COVID? And of course, I start worrying about myself.
Consultant intensivist Dr. Lee Chew Kiok has been through the peak of 2 waves of the pandemic in the intensive care unit at the Sungai Buloh Hospital since March until December 2020.
Last time, I think the maximum patient that I take in during the March, the time actually is maximum. Every day there will be 5 or 6 admissions in ICU Sungai Buloh. Now we have 18 referral per day, and we are taking about 10 to 12 patients per day. So can you imagine? So the number is increases. They are more sicker. It's really a tough time for everyone.
Although the authorities have made arrangements and are sending more manpower, this issue remains a constant source of pressure.
Okay, manpower is the main issue because we need a very specialized ICU nurse to take care of ICU patient. This group of nurses, they come in from other place, they don't know, they may not be familiar with Sungai Buloh Hospital. They may not know where is the ICU also. They may not know where is the machine is put on. And they may not use the same type of machine as compared to other, his or her own hospital. So they need time to pick up. We need time to train them and to make sure they are familiar with that place already. Then only they can in charge of the patient. So all this needs time. So that's why the recruitment is still going on now in Sungai Buloh Hospital. We still need volunteers to come and help us. COVID patient is another group of patients. They stay very long. All right. It's not that the care that we give to them is different from the normal pneumonia patient. COVID pneumonia is a bit different. They require longer ventilation day. That means that they need to put on the ventilator for longer period of time. So normally we need to put them on ventilator about 5 days, as an average to 7 days. 5, 7, some up to 10 days. I even got patient need to be on ventilator 1 month. Longest staying patient actually is 3 months in ICU, the one that I have in March. So they are sicker, they require longer ICU time.
Nevertheless, Dr. Lee and her team have remained dedicated to treating patients as healthcare providers. For every patient that comes into the ICU, they work hard to save their lives, with the hope that the patients will recover and be able to return home to their families. In December, there were more than 40 patients in the ICU at the hospital. The increase of patients not only caused shortages of manpower, but also raised the risk of healthcare workers being infected.
In Sungai Buloh, when we are hybrid, we have 2 intensivists there. So me and the other colleagues, during this preparation for 3rd wave, we are a bit burnt out. So some of us, if we take leave, then only left one of us working. So the maximum patient I have to take care actually is 45 patients, at one time. So I have to work from morning 8 o'clock to even 6 o'clock. I still in the ICU seeing the patient. So I still remember there was, I think it's 21st of December, I start to have fever.
Dr. Lee went for a test after she started realizing body aches and tiredness. And it was on the night of December 23rd, her result returned positive.
So on the night, I was told that I had COVID. Oh, it's a very... I cried actually that night because it's so stressed out. How can I get COVID? And of course, I start worrying about myself. Of course, I start worrying about my family members because I don't know whether I spread any of the virus to them. And they are old. Some of my parents are old. My sister's children are young. So I really worried that I will spread the disease to them.
She was sent to the Sungai Buloh Hospital by an ambulance on the next day and was admitted for 12 days. That was the moment when she got a better understanding of how COVID-19 patients felt.
I need to be treated with steroids. Yeah, because I got some pneumonia changes. And of course, a little bit of shortness of breath and exertion. After the steroid, I recover well. Thanks to our ID team, they actually treat me very well. Yeah, so of course I work there. My MOs will send me food. My nurses will send me food. I spend my New Year Eve, my Christmas Eve in Sungai Buloh Hospital. Unforgettable experience, I would say.
Dr. Lee has now recovered. She was on leave when this interview with KiniTV took place. She never imagined she would be one of the frontliners fighting against an unexpected outbreak, and only to find herself becoming one of the patients. However, she regrets nothing, because when she chose to become a doctor, she knew it would be her job to save lives.
Sungai Buloh Hospital have achieved a very good mortality outcome during the second wave. Of course, because we are not overworked that time, because the maximum patient we have at that point of time is 35 patients. And the wave come down very fast. Within 6 weeks, we managed to flatten the curve. Thanks to the public and thanks to everyone. So this wave, I don't think we can flatten the curve so fast. So we still need the public help now to stay at home, to practice social distancing, to practice SOP. So only this MCO will work, and only we manage to flatten the curve. We have to work together to flatten the curve.
Based on the statistic provided by Dr. Suresh Kumar, the head of medicine and infectious disease at the Sungai Buloh Hospital, the proportion of severe COVID patients who require ICU support has increased from 1.93% on December 7th to 15.49% on January 11th. From December 2020 to the beginning of February 2021, ICU patients almost tripled from around 120 to more than 310. The number of active cases have also increased nearly 5 times, from around 10,400 to more than 48,000.